couple of years ago, I paid a visit to the downtown east side of Vancouver. And I was both shocked and surprised. The shock is self-evident. Anyone who's been there would have seen the carnage of our fellow citizens lying face first on the pavement in overdoses. The many more who stand on 2 feet with their head between their legs, bent over in a spine-twisting posture that is common among those who are maxed out on fentanyl. Spine-twisting postures that leave them bent forward often for the rest of their lives. Those lives often shortened as the game of Russian roulette using fentanyl risks ending their breathing every single time they do it. The unmistakable smell of too many people and too few bathrooms. The tents that go block after block after block. The police pointing to one tent, identifying it as the headquarters of the, quote, United Nations, a self-described gang which supplies the guns and the other deadly weapons onto the street. The people screaming at the top of their lungs, having lost control of themselves in an ecstatic state of near overdose. These things are all stunning to witness, even though you might have expected, knowing the stats, that they were all there. We know that this downtown east side was an experiment brought in by the NDP municipal and provincial governments. But it was an experiment that the Prime Minister saw and said needed to be expanded right across the country. And he has succeeded. Now these tent encampments are regular in every part of the country. In your home province, Mr. Speaker, Halifax has 35 homeless encampments. 35 in quaint, beautiful, peaceful Halifax. Every Canadian knows of such an encampment in their community, even though 9 years ago it was unthinkable. The unmistakable link between this policy and the results that I just described play out now in the rare but courageous journalism that has begun finally to expose the cause. I point to the National Post, in which, I quote, Miller says that her daughter Madison told her that, quote, they could go up to a drug addict and ask for dillies. That is the slang for hydromorphine funded by government. And they'd have bottles for them because they would go into pharmacies, get them filled up, and sell them to kids, end quote. The National Post on March 11th, 2024, I had several patients who were drug-free for a long time and just couldn't resist the temptation of this cheap hydromorphine that was now on the street, said Dr. Michael Lester, a Toronto-based addiction physician. Every addiction medicine doctor I've spoken to has told me that on a daily basis in their offices, they're dealing with diverted hydromorphone, either from new clients coming in addicted to it or patients of theirs that are using it as a drug of abuse. The global news provided rare, courageous journalism on this as well, showing that the price for a hydromorphone pill on the streets of Vancouver has dropped from $10 to 25 cents since the government began subsidizing and spreading the drug far and wide. Reports of dealers standing outside of pharmacies waiting for those who have the prescription to get the so-called safe supply to immediately deliver it to the dealers who can then sell it in order to finance other terrible drugs. And then, of course, we have the overdoses that result as people graduate from those drugs. The Prime Minister has all of this evidence. He has the evidence that since he took office, overdose deaths are up 166% nationwide, and they are up the most in the places where his and the NDP's radical policies have been most enthusiastically embraced. That is British Columbia, where they have grown by 380%. Only with an election on the horizon did the BC government there admit their failing and try to reverse the policy just in time to go to the polls. But still, Toronto and Montreal are applying for the same decriminalization of hard, illicit, unregulated drugs that cause such carnage in British Columbia, requests that the Prime Minister steadfastly refuses to rule out. I said that I was shocked and surprised. Mr. Speaker, what surprised me when I went to the downtown east side was the people who greeted me there. They were not the addicts. They were not the police. They were a small platoon of activists who somehow learned of my arrival, even though it was unannounced and not posted anywhere for either the media or social networks. They were there to record and follow me, to heckle me, which is fine. I can deal with that. I do it every day. But it confused me. Who is paying for all of this?
Right.
Where's the money coming from for the activists that are pushing this? Well, it turns out that there's a lot of money being made. Let me read some headlines here. Prof and former public health officer launch company to produce legal heroin for treatment. Martin Schechter, who led the study called the North American Opioid Medication Initiative, Naomi, and Perry Kendall, BC's first public health officer, are moving to change that. They, frustrated by the lack of action from government, the two have launched a company called FPP, short for Fair Price Pharma, with the goal of producing an affordable domestic supply of legal, injectable heroin for use in treatment. More than 5,500 British Columbians have died from illicit drug overdoses since 2016, including 170 in May. Dr. Schechter, who is also professor of the School of Population and Public Health at the University of British Columbia, said in an email that the overdose poisoning crisis was a failure to expand legal heroin, a proven cost-effective treatment in the face of desperate need for a safer supply. That drove the two doctors to act. Mr. Speaker, how did they act? They said that he has a company to set up a dedicated facility to manufacture the product and offer it at a cost to interested healthcare providers, including those in other provinces. He and Dr. Kendall are expected to meet this month with Health Canada's Therapeutic Product Directorate, which regulates prescription drugs, to determine the tests and evidence needed to obtain a license. They estimate they need about $3 million to launch the product. Mr. Speaker, of course, they're making money. Later, they would complain. BC doctors upset their safe supply of heroin is going unprescribed. During the overdose crisis, they began to lobby for more money. Here are some other headlines. Role in the opioid crisis, name Perry Kendall, former provincial health officer until 2018, advocate for safe supply, founded Fair Price Pharma to distribute heroin. Mark Tyndall, BC's the Deputy Provincial Health Officer and Executive Medical Director, founder of My Safe Project. As I said, Martin Schechter, who was not with the BC government directly, but was responsible for the research that led to the so-called safe supply, and he founded Fair Price Pharma. These are the companies that are actually making the money and intimidating opponents of their plan. This is turning into a gigantic, self-licking ice cream cone, Mr. Speaker, one that needs to end, that is in the service of money-making and not of the public. That is why common sense Conservatives will stop funding hard narcotics, will ban hard drugs, will put the money into treatment and recovery services that will bring our loved ones home drug-free. Thank you.